and welcome to ET Studios Tech Heal in association with ET Health. Today we're spotlighting how tech can make healthcare more accessible and affordable for all. Meet Sidharth Gurjar, who is the CEO and co-founder of Medfin, a digital healthcare platform, and they have an innovative suite of financing, diagnostic solutions, and telemedicine. Thank you so much for joining us today.
Thank you, Shubha.
You know, in just 6 years, you launched in 2018.
That's right.
You have an impressive footprint of 1 million registered users. How did you manage to garner so many users in a particularly crowded digital health landscape?
When we initially started, the reason why we have the name Medfin was we started off by saying healthcare, we want to offer medical loans, right, to people. We thought the accessibility and the affordability part of it will be financed through medical loans. Very quickly, we realized that, a lot of people came back to us and said, while the financing is important, the healthcare costs were very, very high. So we sort of moved on from that journey and where we are today. So we initially started our platform offering medical loans to all our customers. And we actually realized from speaking to a lot of those customers, everyone came back and said, while the financing is important, the overall healthcare costs were very, very expensive. So we actually took their feedback and then said, okay, fine, let's build a platform where we're able to add more transparency in terms of costs. How do we bring down those costs? And in that entire journey, how do we maintain the quality that other hospitals and other ones were providing, right? So essentially, Medfin is a platform right now. We have 5 hospitals all across Bangalore. And we actually deliver surgical and diagnostic scares across all these 5 hospitals.
All right, and making healthcare accessible to all, right, especially those in the lower income populations. How do you manage to do that via your platform? And also, when it comes to tier 2 cities, how do you plan to expand that?
So absolutely, I'll address the affordability part, right? Essentially, what our platform did was very early on, we realized that what really makes people trust a platform is the quality of doctors, right? So we said, let's try and ensure that we never ever compromise on that. And we sort of went about this in forming 3 C's, right? The first C was saying, how do we curate? Saying, if you want to get a surgery done through a doctor, who are the 3 or 5 best doctors in the city for your particular surgery, right? So if you want to get a TKR done, if you want to get a vascular surgery done, who are the best doctors in your city? And we sort of went out there, ranked them based on their experience, outcomes, and patient experience, right? We ranked them, we put them on our platform and said, these are the best doctors available. The second C was really saying, how do we improve the customer experience? We wanted to be a platform where the patient only interacts with us. We handle all the paperwork, we handle all the logistics, and we ensure the entire patient experience gets managed by us, right? And the third C was the cost aspect, where we said if we take really good quality doctors, right, doctors who are at the Apollos, at the Manipals, at the Fortises, got them onto our platform and got their surgery done at tier 2 hospitals, we can get those costs down by at least half. And that's the real big sort of push that we got from patients, where they said the biggest non-negotiable for me is the doctor. As soon as you get that and the cost aspect, that's what really got us in terms of the connection with our patients and how we sort of grew over the last couple of years.
All right, and when we were earlier talking about tier 2 expansion as well, right? Talk to us about this unique med camp that you have set up at Medfin.
Absolutely. So, we did an experiment initially in a city called Tumkur, right? So Tumkur is a small town outside of Bangalore. It's about 2 hours away, has about 300,000 people. And what we found is a lot of people would travel from Tumkur all the way to Bangalore to get their surgeries done. So we want to try and see what exactly we can do to make sure that our doctors, 4 to 5 of them every 2 weeks, could travel to Tumkur, make sure we interact with them there, and get the surgeries done right there, right? So the model was we send a team from our company a week in advance. They go do a little bit of awareness campaign. We partner with the hospital there, and we get our high quality doctors from Bangalore all the way there. They do the consultations, and any follow-up consultation gets done online, right? So essentially saying that even the hospitals, when we spoke to the hospitals and our partners, they said we have all the infrastructure over here, but our rooms are empty because all of them go and do the surgeries in Bangalore because they don't trust the doctors here. So we said let's try and fix that problem. We got the doctors from Bangalore all the way there, and then we started seeing patients saying, now there's no reason for me to travel all the way there. The costs are a lot lower because I don't have to manage the overheads of Bangalore. Tumkur costs in terms of real estate is much lower, and I'm able to stick to the quality. I'm getting the best doctors from there all the way here, so there's no need for them to travel. A lot of these hospitals do these camps across all the other towns, but a lot of those camps require them to come to Bangalore to get the surgery done. We wanted to stop that by saying we'll get our doctors there who will actually come there, do those surgeries there, and come back to Bangalore. So as we spoke about how that journey evolved was we found a lot of people coming in inquiring who exactly is Medfin, what do we do? But as we started doing more number of those camps and those interactions, the number of people built up. We started getting a lot more inquiries for surgeries we never did. And then we sort of built up the entire model. And in the hospital said, right, this is fantastic. People are now getting surgeries done in Tumkur rather than going all the way to Bangalore. Hence, now it sort of enables the hospital to make those investments. Earlier, he was saying, I have no money to make those investments. Now I'm able to make those infrastructure investments and make sure that the entire system starts to grow by itself in these tier 2 towns rather than getting them back here.
Okay, that's an interesting rollout. But when it comes to more rural and more inaccessible areas, there you have a solution via telemedicine. Talk to us how you're improving the efficacy of telemedicine and also making sure it's more accurate.
Absolutely. So, when we first threw out this idea to our doctors, they said, you know what, we tried this before. We would go to the small towns, but when I would sit there, I would find no patients out there because they never even knew that I was coming there. So awareness was a big problem there. Two is, he said, man, the whole concept of telemedication is fine for cough and cold. For surgeries, it's not going to happen. I need to see the patient, I need to feel the patient. And when we found out why, he said, when I asked them for symptoms, when I asked them for all these things, the interaction wasn't really giving me that confidence. So I'm not okay with telemedicine. So what we said was, let's start doing these camps where when you're back in Bangalore, after you interact with the patient, we have a nurse with the patient, right? So the patient goes back to the hospital, sits over there with the nurse, and now when you're interacting with him, you have a medical representative in the room who can sort of answer those queries and sort of help them in the entire journey. That completely changed the model, right? Because now he's a lot more confident. He's saying, okay, fine, I have a person over there who's my compadre there, whom I can discuss and say, okay, fine, have you looked at this? These could be the symptoms, this could be the access, and then sort of help in that coordination. So I think when it came to those aspects, we're able to sort of make sure that delivery of the healthcare can actually happen in those towns. Even the smaller towns there, they're saying it's a lot more accessible because now my journey is about half an hour to get to Tumkur rather than 2.5-hour, 3-hour journey all the way to Bangalore. So that helps in that kind of delivery of healthcare.
All right, and so we went through health financing, we went through telemedicine, and you also offer diagnostic solutions. Talk us through that.
Right. So, one of the most important aspects in our entire journey has been early detection, right? We actually found that if we can create an environment where we're saying, rather than when you face your first symptom, come to us every year, come and get a couple of tests done so that we maintain sort of a health profile of yourself. That helps us in your next visit and next visit, right? So when you meet our doctors, it's not a complete blank slate. He has your test reports, so he knows what sort of questions to ask you. And when I build that health profile and as we sort of build it going forward, I'm able to deliver a lot more personalized care. So think about it, if for example, I have no history of diabetes in my reports or anywhere else, I can square off those tests required for the same, right? As compared to if I have certain other things that are health indicators that are going off the charts, I can start having those things detected early on and start putting on medications very, very early on without you requiring a surgery. I know that's kind of counterintuitive to our model, but our whole idea is if we can catch your symptoms very, very early on, we can prevent you from going on the table. And that's our entire goal right now.
All right, and now the Indian healthcare industry is expected to boom to about $638 billion by 2025.
Yeah.
Being a pioneer in this space, what are the sort of innovations that you see that are going to become more popular in the coming years?
I think there are two aspects. One is in the health insurance space. I think health insurance, in terms of its penetration right now in India, is very, very low. It's growing from when COVID hit, but I think it has a huge amount of potential sort of increase. If health insurance players can get more policies that are a lot more transparent and affordable, you'll see a huge pickup in terms of people, right? Be it corporate insurance and in terms of personal insurance. So I think that's a big area that you should see a huge amount of interest and innovation. The second part is also on the AI front. You find a lot of innovation in terms of early diagnostics, right? Really encouraging people to sort of come in there and get their test done regularly rather than when they hit their first symptoms. I think that concept of continuous care rather than when you hit your first symptom is something that you'll start seeing expand on as the years go by. If you look at NH, right, they've launched a new insurance plan. And if you hear them speak about it, right, they're always talking about early, can we catch these symptoms early on, try and prevent you through medication rather than waiting for that particular symptom to require you to go under the table. So I think that's something that you should start seeing sort of play out. One is on the health insurance front, making it a lot more transparent and accessible. And the second part is ensuring that people look at healthcare a lot more differently in terms of coming for annual health checkups every single year.
Now, we're above the WHO standard when it comes to the doctor-patient ratio, which is 1:834 as of July 2024. Now, as a digital healthcare platform, how are you helping healthcare become more accessible in a space where we don't have enough doctors when it comes to patients?
Absolutely. So and I have a bit of a different view on this. I think the number of doctors are fine. The problem is the concentration, right? You have all the really good quality doctors in your metros. Go 200 kilometers outside the city, there's almost no healthcare infrastructure as well as quality of doctors, right? So I think a model that we tried in Tumkur, where we have these camps set up in these areas, where we actually get really good quality doctors to sort of go there every week or so, or every other day. That kind of is a model that can really help rather than saying, okay, fine, I need to create more number of doctors. While that is really, really required, I think if we can get in the short term, get doctors to sort of go to these small camps, do those scans, do those consultations, and do those entire investigations at that particular place, I think that will help in the accessibility part. The more you ask people to come into the metros, your costs will go higher. So if you can get those interventions done at those particular smaller towns, I think you'll address both the accessibility part as well as the cost-effective part.
The medical equipment that is required for these sort of checkups, you carry them across to these towns. Also talk to me about the evolution of this equipment, considering you own some of it, right, to offset the cost for these patients. How is MedTech evolving currently?
Right. I mean, you see some huge amount of innovations on that front. So when it comes to the smaller instruments, those are some things that we can take, right? But if you look at the MRI machines, the CT scans, right? These are some things you can't really transport. But you see a lot of hospitals in these smaller towns saying, I'll make the investments. If you can ensure utilization, I'll make those investments, right? And I think that's where you'll find the model working out, where you're saying, the biggest reason why they don't get done there is because people are saying, okay, fine, I don't trust the quality here, I don't trust the providers here, hence I would like to go all the way to the metro cities and clog up spaces over there rather than actually doing it there. So I think a mix of both, right, where you're saying the innovation can happen on both sides. When you're taking these doctors always there, those people will make the right investments to make sure that that healthcare infrastructure is available in those smaller towns there.
Being somebody from this field, how do you think the digitization of health and health records is going to transform the landscape?
When we started this 6+ years back, prescriptions were still largely, even now, gets written by hand, right? I think one of the first things we need to start doing is ensuring that they sort of move online. It sort of has a ripple effect across the entire system. We can use AI and read those prescriptions and make those analytical choices rather than reading off handwriting. So I think prescriptions and a connected system where rather than you having a piece of paper and you're showing it to multiple people, if that gets shared automatically along with all your reports, I think that connected system really helps in the entire evolution of healthcare. The more you have it offline, the more you have it broken up. If, for example, I go to Apollo and Apollo is not talking to Manipal, who I'm the next doctor I'm talking to, it's a broken system. The government's playing a huge role in this to sort of connect the entire system, and I think that's something that you should start seeing everywhere. So the idea here is, if I go to one service provider, it should have all my health records available there, so that doctor who's sort of advising me, he knows my previous health records, issues, and what sort of things I need to sort of take care of. He'll be able to give me a lot better care if the entire system's connected.
Yeah, absolutely. And while that seems like a futuristic view, I hope that's in the works and it's going to come up in in the very near future. Thank you so much, Sid, for joining us today at Tech Heal. It's been an absolute pleasure speaking to you and finding out more about the medical insurance space, medical financing, and also the sort of innovative work you are doing in this entire area.
Thank you, Subha.
Thank you. Thank you so much for watching, and for more such insightful conversations with such pioneers, remember to stay tuned to Tech Heal.